this today? Like, why didn't you come earlier?
Well, because now I feel that my hands and my feet are getting numb.
Oh, oh, okay.
Yeah, I have a lot of numbness. I can grab anything.
And how long did that start?
A week ago.
A week ago. Okay.
Yeah.
All right. What were you doing when all of this began? So, have you had any life changes in your, in your work life or your personal life that may have contributed to this fatigue?
Well, I have to tell you that my job is very stressful.
Mm-hmm.
And I thought that it was because I was so stressed out in the past 2 months.
Mm-hmm.
But now I'm very concerned because my hands are numb. And,
Mm-hmm.
I just...
Yeah, so the numbness really brought you in here.
Yes.
Okay, so tell me about your energy level. Tell me about your energy level like 4 months or 5 months ago. And
I used to exercise 3 times a week.
Mm-hmm.
I was always very active, doing things around the house.
Mm-hmm.
But now I just get home and I just want to just lay there, sleep.
Just go to sleep right away. Okay, all right. So tell me about the numbness and tingling. Did it start when you said it started about a week ago? But is it all the time or does it come and go?
Yes, it's all the time.
Okay.
All the time.
And have you seen a medical professional for this condition?
No, I haven't.
No. Okay. Have you taken any medications or anything that would alleviate the numbness or the tingling?
No.
Nothing?
Nothing at all.
No.
Just decided to come and see if you guys can help me.
Okay. Have you ever had a history, anybody ever tell you had a history of like low red blood cells or low hemoglobin or maybe anemia? Do those words ring a bell?
Well, I have a cousin that she's a phlebotomist.
Okay.
And she was doing some blood work on me the other day. And she
Oh.
did say that I have a low blood. I'm not sure. She gave me the paper. I'll show it to you.
Do you have it?
Yeah.
Oh, okay. Oh, okay. So this is a blood work?
Mm-hmm.
Okay, all right, we'll talk about it at the end, okay? We'll look at them later. Have you had any other symptoms like night sweats or chills?
No.
No. Have you had any fever that you can tell if you've had any fever at all?
No. Fever.
Okay, what about nausea and vomiting?
No.
Abdominal pain?
No abdominal pain.
Diarrhea, constipation?
No.
Any problems urinating?
No.
Any pain in your chest?
No.
How about like your heart racing a little bit?
Oh yeah. Sometimes, like when I go up the stairs, my house is a 2-story, and then when I go up the stairs, like when I get to the second floor, I'm like out of breath.
And that wasn't happening like 4 months ago? It just started happening now? Okay. Have you noticed any lumps or bumps in your neck? Like here or here?
No.
Okay, how about having any joint pain or muscle pain?
A little bit.
Like in your joints?
Yeah.
Do you have any dizziness or headaches?
Yes, I get dizzy all the time.
Dizzy? Okay. What about...
Like I feel like I lose my balance. I don't know.
So you're swinging from side to side something. But is it happening all the time or just every so often?
I think it's happening frequently now.
Frequently, okay. Do you smoke?
Yes.
And how much do you smoke?
I smoke a pack a week.
A pack a week? For how many years have you been smoking?
10 years.
10 years, okay. Have you been around sick people lately?
No.
Any children that have been sick in your family
No.
or anything like that? No? Okay, have you ever been diagnosed with any conditions in the past? Like maybe high blood pressure or high cholesterol or high sugar level or anything like that?
No, never.
All right, and when you were a child, did you have any diseases like the chicken pox or the mumps or rubella or anything like that?
I have the mumps.
Mumps?
Yeah.
Okay, all right. No problems after
No.
that? Okay. How about any surgeries? Have you ever had any surgeries in the past?
Yes, 6 years ago,
Mhm.
I had a gastric bypass,
Ah, okay.
and that was the only surgery I
Okay.
had.
And you didn't have any complications in the gastric bypass surgery?
No complications.
And after the gastric bypass surgery, have you been back to see the surgeon?
Yeah, I went back like
Uh-huh.
like a month after I had my surgery,
Mm-hmm.
and
He said everything was okay?
everything was going well.
What about how many pounds did you lose?
100 pounds.
Oh yeah? Oh, Congratulations. And have you did you keep the weight down?
Not the whole. I mean, not all of it. You know, I'm trying. But now, since I have no energy, it's so hard to exercise.
All right. Okay. Any allergies to any medications or anything?
No allergies.
Medications that you take on a regular basis, do you have any of that?
No.
So normally after gastric bypass surgery, they ask you to take some vitamins like folic acid, like vitamin B12. Sometimes they ask you to take iron. Did they tell you to take any of that a long time ago, 6 years ago?
Well, I'm gonna be honest with you. When I went to see the surgeon, he did tell me to take vitamin B12 and folic acid and also iron. But the only one that I really started to take was the iron, and then since it got me so constipated, I stopped. And then I never took.
You never took anything?
No.
Nothing at all after the gastric bypass surgery?
No.
Oh boy.
Why is that bad?
I'm suspecting that something's going on with that, okay? But we'll talk about it after. So how about any alcohol? You drink alcohol on a daily basis? Okay.
Socially.
How many alcoholic drinks do you think you drink on a weekly basis?
Maybe 3.
Okay.
Yeah.
Do you use any drugs?
No.
Okay. What do you do for work? You said you have a stressful job.
Yeah,
Huh?
I'm a secretary at a law firm.
Oh, law firm. Oh gosh. Yeah, I'm sure that's crazy, right?
Yeah.
Do you have any children?
No.
Are you married? You live with your husband?
Yeah.
Okay. What about your mom and your dad?
My mom, she's been pretty healthy. She
Mhm.
was diagnosed with breast cancer 2 years ago,
Okay.
but she's doing well.
And your father?
My dad is alive. He's healthy. He's 76.
Okay.
Yeah.
Your grandparents on your mom's side, okay? Or are they
They're deceased.
Okay.
Yeah, they died of old age.
Okay. All right. How about your grandparents or your
Same
dad's side?
thing. They're deceased. You know, old age. They were alive until they were like 98, 97, both of them.
Oh wow.
Yeah.
Mhm. So they just died of old age.
Mm-hmm.
All right. So I wanna do a quick physical exam. And
You
then,
want to keep the
yeah, I'm gonna
results?
put the blood work over here. I'm gonna put it over here, and then we're gonna talk about it. Okay?
Okay.
So I'm just gonna do a quick exam, just to see how everything's going, and then I'll tell you kind of what I'm thinking, and then what we're gonna do about it. Okay?
Okay.
Okay. So everything's okay over here. You don't have any pain anywhere or anything like that.
No.
Okay, fine. Just looking in your eyes here. So looks like this little area here, which is called the conjunctiva, is a little bit pale, and that happens sometimes. Okay. Open your mouth. Say ah. Okay. So there's nothing there. So everything's pretty much normal here. Your ears look good. Everything's good over here. Okay. Now your neck. I don't see any. I don't feel any lumps or bumps or anything in your neck. Open. Put your. See. No lumps or bumps underneath your axilla or anything like that, okay? I'm gonna listen to your heart a little bit. Okay. Okay. Your heart sounds normal, okay? I'm gonna listen to your lungs. Take a deep breath for me and good. Again. Yep, take a deep breath in and out. Very good. Okay, so that's okay. That's perfectly normal, okay? All right. How about your belly? Is there any pain in your belly? No? Nothing like that? Okay. All right. Obviously, we would be laying down to do this, but...
Yeah. It's okay. Thank you for seeing me today.
Huh?
Thank you for seeing me.
Yeah, no problem. Okay, so let me just take a look at your feet. Okay. I don't see any swelling or anything in your legs or anything like that, so that's okay. All right, perfect. Okay, now basically gonna do a couple of things to figure out about your you said you had a little bit of balance problems, okay?
Mhm.
So what I want you to do is I want you to stand up for me. Just face that way. Right here. Just stand up there, okay? And what I'm gonna try to do is to see if you have any problems with your balance, okay? So close your eyes for me, okay? And I'm just gonna tap you and see if you sway from side to side, okay? Are you okay?
Yeah.
Do you feel a little dizzy right now?
Mhm.
Yeah? Okay, okay. Have a seat, just have a seat. Okay, good. All right. Okay, great. Was that,
Yeah.
you're a little dizzy? I saw you swaying from side to side a little bit.
Yeah.
And,
I thought I was gonna fall, so I was afraid a little bit.
okay. Okay, fine. No, just stay right there, okay? What I'm gonna do is I'm gonna use this sharp object, and I'm gonna do it here in your legs to see if you feel me touching you, okay?
Okay.
You tell me if you feel sharp, okay? And then I'm gonna do dull, okay? So close your eyes for me, okay? So you tell me if you feel this, okay? I'm
Sharp. 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 Sharp.
okay. What about here?
Dull.
Okay.
Dull.
Okay, so you're okay with that. You can feel everything,
Yes.
okay? All right. I'm gonna do the same thing on the other side.
Sharp.
Okay.
Sharp.
Okay.
Sharp.
All right.
Dull.
And you can feel everything that I'm doing, touching you and everything, right?
Yes.
Sensation-wise, you're okay. All right. Okay. All right. So I want you to squeeze my fingers and squeeze as tight as you can. Tight as you can. Okay. Very good. Very good. I'm gonna do. You see your legs? I'm gonna lift your legs up and I'm gonna try to push them down. Okay. But don't allow me to push them down. Okay. 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 Good. You have pretty good motor. You know, like you're strong, okay? So it looks like basically the only thing that looks like maybe your balance is just a little off.
Yeah, I thought I had vertigo.
Vertigo? Have you ever had vertigo before?
Yes.
Yes?
I mean, I think I sometimes I don't know, it's just dizzy, but I don't know. My friend has vertigo, so I wonder if I
Oh God, no. Well, that's a whole different story, you know. Vertigo, you get really, really dizzy and like you have to sit still. But if
yeah, my friend gets really bad.
yeah, like your whole room is spinning. Have you ever felt that?
No, it's basically
Just the dizziness and
the bounce. Yeah.
Okay. So what happens is that I looked at that blood work that you basically gave me from your cousin, and of course, you know, I have to do my own labs. Yeah, I have to do my own labs because over here. Okay, so I have to do my own because you know we got to do a very detailed assessment. But here it says, yeah, your hemoglobin is 9.5.
What is it? What that means?
And your hematocrit is 27.5. The normal hemoglobin is about 12 for a woman. So your hemoglobin is actually on the low side, okay? We also, there's a test called the MCV, and this one tells you how big or small the cells are, and yours are big, like they're 105. So that's, the MCV is 105, so the cells are big, okay? And then also it says here, I don't know, she drew a lot of other labs, like she drew your iron level, and your iron level is actually okay. It's not the problem, but what the problem is this vitamin B12 level that is actually pretty low.
It's low.
Yeah, it's like almost like you have none. It's like 2. Okay, so your vitamin B12 is 2, and then your folic acid is 5, and so that's actually very, very low.
So do you think that this symptoms that I'm feeling is because of that, or?
Yeah, the thing is that sometimes vitamin B12 deficiency is actually caused by the gastric bypass surgery. So